So here we are in Fundamentals of Therapeutic Massage. We're working on a Unit 2, and our focus on this clip is going to be um, Chapter 6, Indications and Contraindications, is the main focus of the chapter. So we're starting out with a little bit of a hairdo thing here, and my bird's chirping in the background. So we'll see if we can get through this without the cats walking across the screen. So let's see if I can actually get to the screen. So we're going to share the screen. Oh, we don't want that, but we do want, yeah. And there we are. Foundations for massage benefit. So this is our unit that we're working on, and we've discussed Chapter 5, Research Literacy and Evidence-Informed Practice. And I also posted a clip on the playlist about how to use Medline Plus. It's an excellent source of information. And PubMed, which is the recommended starting point for you to look for peer-reviewed and vetted research about massage therapy or other things. And so we looked at evidence and information related to justification based on biological plausibility of what the potential benefits are for massage and how that will affect our interface and treatment planning and massage application with clients. So now we're going to Chapter 6. So this is an interesting chapter because there's no real definitive answers for this. And there hasn't been really a ton of research on whether or not massage should be avoided. We're really working on logical assessments of situations and making decisions based on that. If we go back to Chapter 5 and appreciate the mechanisms that are potentially involved with massage therapy, and we look at other forms of manual therapy and manual therapists, which would include physical therapists, athletic trainers do manual therapy, osteopathic physicians can do manual therapy, sometimes occupational therapists, physiatrists, and those are the professionals using manual therapy within the more medical type environments. And they would be dealing with more fragile clients that possibly can give us some information related to what massage therapy can do. And we saw in Chapter 5 that generally massage is safe, especially if it is provided by a massage therapist that has been trained in making good decisions about massage therapy. So in order for us to really understand indications and contraindications, then we've got to look at what the massage therapy practice kind of entails and how we think about each session we provide for a client. So that starts our chapter outline, talking about approaches to care. We have talked about this before. This is an ongoing theme throughout the book. And then if we're going to determine contraindications, then we've got to have a working knowledge and know how to find information related to pathology so that we can use that information as we're developing a care plan for each client. There, in the YouTube video list, the guest lecturer list, there's a whole section on pathology. Pathology in no particular order. It's that way on purpose. What I want you to do is just click through. That whole list is actually connected with your essential science studies, but there's access to it through here as well. And or do your own search on pathology. And YouTube is a great resource. So is Medline Plus. Get really familiar with Medline Plus. So, okay. So these approaches to care, they set an expectation for what the outcome would look like. And so as we progress down, we'll take a look at that. And then that also feeds into an understanding, the decision on this feeds into an understanding about general information about pathology. And when you look up a disease condition and or look up a medication, look for signs and symptoms and side effects to various treatments. And then you can categorize risk for somebody developing an illness and or an injury. And we'll review that. And then you can also come up with some generalized ideas about where to start with caution, not fear, caution. And when we work from informed practice using caution, then there's very few things, very few conditions or circumstances when massage is contraindicated. And most of those would be in serious, acute situations, whether it's an illness or an injury for that period of time, or we might avoid an area. So let's proceed. Here are all of our chapter objectives. Make sure you read through those along with our key terms. And as you know now, the textbook's divided into these study chunks. And so each section would be a study chunk. So the first thing we're going to look at is indications for massage. And an indication means that there is potential for benefit. So that is weighed against potential for harm and or are the benefits worth the cost? Cost in money, cost in time. And so sometimes people will go, well, massage has helped, but it didn't help enough, or it didn't help any more than yoga or a walking program or something like that. And so they know that massage is helpful, but they can't justify that as a care approach because of the cost or time. Okay, so this little segment right here kind of talks about the categories of contraindication. So I already mentioned the general avoidance. It's rare. Usually we can adapt and find a way to provide safe care, even in acute situations, by modifying. There is an approach called M technique. Search that on YouTube. There are some nice videos there, and it was specifically developed by a nurse to provide comfort care within an acute setting. And so it's a stylized routine, started out for the forearms and hands, but others have expanded that for like the feet and lower leg. And it's very easy to learn. It's very rhythmic. This is something you can teach yourself through a video. M technique. And so even in situations where the person is quite fragile, possibly the comfort care of that style could be used. And the intent of that was to be able to teach caregivers, other family members, for example, on something that they can do. Often it's a regional avoidance. So if somebody's got a scrape or something like that, the skin is compromised, then you need to stay away from that area and far enough away from that so that you avoid any kind of infection potential. It also could be where somebody has had chemotherapy and or radiation. Let's say for breast cancer, over the breast, over the thorax, and maybe they've got some brittleness there in the ribs. Maybe we would alter what we would do there. So if somebody has got poison ivy, we may want to wait till that settles down a little bit before we do massage, because it can rub off on other like the sheets and things, but at the same time, massage can also be beneficial if that area is covered so that it doesn't spread, but we certainly wouldn't work in that area. And there are other situations where it looks like we might need to avoid the area, but maybe not. I think of psoriasis, which is non-contagious, and unless the skin is raw or bleeding or splitting, and there's a level of integrity still with that, the skin, massage is not necessarily contraindicated in that area. So this makes sense most of the time on what we would avoid. So, and it'll be expanded as we get through into the textbooks. And then here's where we spend most of our time. We have to stop, look, and think. Okay, here, and research. So a client has diabetes. I continue to use that as an example because it's so common right now. And they are on an insulin pump. And that means that their body really cannot self-regulate that anymore. So I need to know now, okay, diabetes in general, that is Medline Plus, and I need to know about the medications that might be used and the devices that are used. And we start there at Medline Plus. And certainly ask the client. The client has got a lot of information too that we can confirm with Medline Plus. And then we can go to PubMed and we can do a search on massage and diabetes and contraindications, and see if we can get some research information that can help us make our decision. We can communicate either directly or through the client with the other care team for this person, because if they're diagnosed with a condition, they would have other health and or medical professionals that would be working with them. So they might have a dietitian, and they might have an endocrinologist, and they would have their general practitioner. They might have a nurse educator and a program for diabetes management. They might have a personal trainer, because exercise is so important if somebody has diabetes. And so if we become part of that team, I'm trying to turn my phone off. If we become part of that team, then we want to have some type of communication back and forth. Either we are working in an environment where that team all coalesces for this particular person, which probably is rare, or we are cross communication. And then if that is the case, then we have to go back to chapter 2 and have release of information, documentation, so that we can communicate back and forth. But we have to understand a little bit then about what the other professionals are doing, and then how massage therapy fits into that, and how we might need to adapt what we're doing, and or how we might want to focus to help support a comprehensive care plan. So palliative care here, this is how we're developing an approach to care. How am I going to work with this client? I've worked with professional athletes, which is not a level of status for sure. It's just how my career evolved. And I can tell you that many times what I am doing is a palliative approach. Post-game, I think of when they're ramping up in various training camp situations, when they're tired and they have exerted themselves. If there has been a period of loss, one game after another where they've lost, or there's been some additional demand with that situation. So that's one area where I use the palliative approach a lot, that sometimes people think, oh, this palliative is end of life care. Well, it can be, but it's about reducing suffering. And hospice is a great example of an interdisciplinary approach to palliative care. But if I have a generally well client that's has bought a gift certificate for their parent, and that parent is generally well, then, but the parent is visiting, I am not going to try to develop a comprehensive care plan for that gift certificate. I'm going to focus more on a palliative care plan, which is more about the experience at the time the massage is being delivered, and a 24-hour sense of satisfaction from that. Now, restorative care is different. Restorative care is set up to be an ongoing care process for a client that you see on a regular basis, or at least for a series of sessions. And as explained previously, and then a reminder, remember this is a scaffold program where we keep coming back to major concepts. This is a lot of what we do, is that life is energy, costs energy. It takes energy for us to live our life. And it's nice to have some help to support our general ability to restore and renew ourselves. So in restorative care, we're not specifically targeting a pathology. We're more cleaning up little physiological messes, and we are maybe focusing a little bit on a target area that was used, or a situation. Maybe a person had a flat tire, and they had to change the tire, which would be an unusual circumstance. Their shoulder might be tight or something. I can go on and on with examples like this, but generally nothing is wrong, other than daily kind of accumulation of living life. I can go back to the athlete example. This is also our major category of care, trying to help the body the very best we can, using quality of life, well-being approaches, relaxation. That's how we restore, restorative sleep, and potentially stress management a little bit if it's been a rough week. So that's restorative, and it's usually a full body approach within that general hour to sometimes hour and a half type session that you find in the wellness setting. Now it gets a little more complicated. With condition management, there is an assumption that somebody has a condition. So there are other professionals involved, and there is something that is challenging the client's adaptive capacity. So they may be taking some medication, or they might be having other treatments, and it's just more complicated now. And so up here, if we are back to the athlete example, if I'm working with a golfer, I'm certainly not a golfer, but I can have a general understanding of how they use their body during that activity, so that I can factor in rotational, repetitive rotational issues are involved a lot with golfers. I need to know about that, so I can understand a little bit what they're saying to me. So there's an increased knowledge there. With condition management, the same, with increase, because now I have to know about the condition. I have to know what treatments are already involved with it. I have to potentially communicate either through the client with other interdisciplinary people that are working with this person. So I might have to understand an environment. if I am working with somebody that is going through a healing process, they've had a surgery, a joint replacement, or they're coming out of a serious illness, this might be my approach. I may start up here at palliative care and then support the healing process in a restorative care, and then also think about condition management, because it takes time to recover. And so this might be how I would approach. So it's not about reversal. It's not trying to fix or heal or anything like that. It's trying to create a physiological environment where the body can do and the person can do the very best they can under the circumstances, and trying to address the main signs and symptoms that massage might be able to mitigate for a little while. And if this is a chronic condition, this is another type of retention client where if massage is helpful to help them sustain, whether it's pain or mobility or chronic stress, if we're able to help through the indications and benefits of massage, we just have to accept massage is going to wear off. That's all there is to it. Medication wears off, all treatments wear off. And so this is something where a regular care plan over a long term is important. So now in these two areas, somebody might get a palliative approach massage as a gift. Or if we go to the other side of that, it may be in a hospice situation. But it's not necessarily something that is going to occur on a very long-term situation, even if we might bounce back and forth between these categories of care, depending on where a person is. But when we are looking at massage as restorative care and condition management, that's pretty much one or massage a week or every 2 weeks forever. And so other factors then come into play, like the burden of the treatment, the time and money, and the cost-benefit ratio. And so this, you wouldn't think this, but it factors into our decisions that we talked about with fee structure, et cetera, in the business chapter. So interesting, kind of overlap when we stop and think about this. Now, chances of a third-party insurance, medical insurance type situation to pay for restorative care, which is very much in the health and wellness arena and very important, that there may be potential in the future for some sort of limited access to massage as part of condition management. That's there now. So if you're employed in a medical setting and paid a salary or a wage, that medical provider can bill for insurance as long as they are following the criteria put forth by the insurance company. Okay, so so third-party insurance is available. It just isn't available in the health and wellness setting. Hopefully in the future, there will be a situation where we really embrace as a society the importance of prevention and health and wellness and quality of life as a mechanism to prevent or to slow down the development of any kind of pathological condition that interferes with a person's quality of life. A therapeutic change, there's a lot of discussion about this as a category of care, and there's a lot of ethics here. The intent of this category of care is for people to reverse a situation. So it's a person is starting with a limitation. It may be a sprained ankle, or it could be a joint replacement, or possibly they have been bedridden for a long time and now they are trying to regain mobility, or they are recovering from a surgery. It may or may not involve pain. Whereas condition management up here, pain is a big thing that massage helps manage. But in a lot of massage therapists, they want to talk about and think about fixing people. There's some status, perceived status there. Unfortunately, sometimes the term medical massage is used to describe this category, whereas massage is massage is massage, and massage is a form of manual therapy that is a system in and of itself that can be used for a variety of outcomes, whereas something like surgery does not kind of fall into that type of a category. So there's an assumption here that something is not functioning well, that there is a recovery process, and there should be ongoing goals for that recovery. In my opinion, I believe that this should be a multidisciplinary approach. There are lots of factors to consider. And with massage being at entry level, vocationally trained, it's helpful. I've been in the situation where I wished I had peers that I could go and ask questions. Now, I've always developed kind of a support system around me where I could go and ask a question. When I worked with a psychologist, and sometimes that's a therapeutic change thing, but often it was also condition management. It was really helpful to not feel as if I had to deal with more serious potential behaviors related to anxiety and or depression, that there was a built-in support system for me instead of me having to be constantly on alert about monitoring behavior for dangerous actions, with depression, often suicide. So with in the athletic arena, I've always appreciated the athletic trainers as well as the physicians that work with the if there's been an injury, or if we're trying to understand a repetitive use syndrome. So it's no more important to work in this arena. And there is a lot less research that supports reversal of a condition. I mean, the key word here is change. Now, there can be improvement over time. If a condition is managed over time, a person's general adaptive capacity should improve. And if that continues, then we can fall back, we can move into a restorative type care or a maintenance care plan that bounces back and forth between these two. But the concept of change means that this is going to come to an end. Either the condition is going to reverse, which is rare, but it could, and massage is no longer indicated, or it has progressed as far as it will, and it's stabilized as much as it can, and then it will fall into this category of condition management. So while this could be this category and this category, restorative condition management supports a retention client base. Therapeutic change inherently is set up for a beginning and an end. And if there is going to be an ongoing relationship with the client, it is because we have moved them into these other two categories of care. So be aware here how you present yourself. That can really interfere with your respect for other care professionals, how you see how you fit into an interdisciplinary team, and the claims you make, which may be unethical if you are promoting an indication or a benefit that isn't supported through evidence-informed practice. This, unfortunately, is a big problem in the massage therapy community. So this next section of the textbook is helping us determine the type and timing of an approach, and it embraces what I just chatted with you about. So as you're studying your textbook, read through this and then remember, the massage therapist must consider all of these factors in order to develop a plan that best serves the client, and that is based on these following elements: a main outcome or combination, relaxation plus pain management, or stress management plus pain management, or functional mobility and pain management, or just stress management. Okay, and important, relaxation, which is going to have a pleasurable component to the massage. It's not going to target a specific pathology or functioning dysfunction, and it is about well-being. So then we have to decide what category of care we're working in that day. And so if the client's a little under the weather or really, really tired, even though our main approach is condition management, I might move into a palliative care process at that time. So this is massage. It's application of this is manual therapy. It's 2 actions and push or pull. And this includes movement. If a client is moving their leg, they are pulling. So let's not think that this is too unique here. And these are the approaches that we use to push or pull. And you can break down any form or style of massage into its application components. And then we modify that. We can take gliding, and we can have an infinite number of applications with that by changing the pressure down, how fast we do it, whether we are rhythmic with it, if we are applying it with a lot of drag with the intent to move the skin and superficial fascia back and forth. this is how we modify each of these methods to adapt to an infinite number of situations with a client. The intent then with this mechanical force is to trigger an adaptation response by the client's body in a biopsychosocial construct. So we have to consider their physical body. We have to take a look at their psychological stability and stamina and adaptive capacity, and also consider the support system within how they function, which we become a part of. But it all comes back to, I am most of the time applying a mechanical force to the soft tissues, and it is causing a deformation, sometimes a movement, which also deforms the tissue, a change in shape with these various, as they're called, stresses. And then those stresses can do two things. They trigger the nervous system listening stations, the proprioception and the mechanoreceptors and the skin receptors, the touch receptors. It triggers all of those listening stations to feed information through the somatic nervous system and also the autonomic nervous system. And it's processed to determine whether or not something has to occur through a motor response back through. And that response to self-regulate in response to these stresses is the benefit. It becomes the foundation for the indication. And so, again, any form, any style, it can be broken down into these components. And then you can take a look at the uniqueness around how this is applied. And one of the things that's unique about massage therapy is that it's usually a full body approach with targeted areas embedded, whereas a lot of other manual therapies are location specific and don't necessarily use the very beneficial full body application of supportive care. Now, these forces, these stresses can also likely temporarily, for a little while, maybe change the consistency of the ground substance structure, kind of the jello of us, and support some sliding. So we're supposed to, each of our tissue layers is supposed to slide against each other without problems. That's why there's lubricating fluids throughout our body. And so, at least for a little while in a localized area, those tissues might be more pliable and they might slide a little better. And that's going to help reduce uncomfortable sensation, and it's going to support more normal movements and functions. And so that's enough. That's all good. Those are all the foundations for indications, and also our way of investigating adaptation so that we apply benefit without harm. So here's a proficiency exercise, and I would like you to spend time working through this. And this is continuing to reinforce a critical thinking model. And so there's a little case study here. And it's going to give you a little scenario to work with. And you can try out your critical thinking processes here. And that is only going to get better with continued practice. So we're going to end this video here. And when we come back, we're going to look at pathology. So lots of really good core content here. Lots of overarching themes. Really supports massage as a manual therapy, but a system unique unto itself. Massage therapy with the intention of benefit, and massage therapy practice with massage being used by a compassionate trained professional. So many occupations and professions can use manual or massage therapy. We are unique in that we embed that into a massage therapy practice.